Okay, hi, I'm Mike Scarano. This is my head-to-toe health assessment final video. So I'm going to go through the steps in our head-to-toe assessment from our lab and go through a set of questions and the sequence of the head-to-toe process as I go into do an inspection and assessment on a patient. Okay. Hi, I'm your nurse, Mike. I'm here to assist you. I know you're here for a couple of different reasons, so can you tell me your name?
Susan Benjamin, and my date of birth is 11/4/68. I'm here for general physical, and I've been feeling tired lately, so I just wanted to mention that.
Feeling tired? Okay, that's good.
Okay.
And so that's your general. You're just here generally for a.
Yeah, my yearly physical.
Okay.
But I've been feeling more tired, and I don't know if it's age or just whatever.
Okay, great. Now I'm going to do a little neurological check on you.
Okay.
I'm going to turn to the video, so I'm going to explain a little bit while I'm doing this, but I am doing this as a patient, more eye-to-eye contact, so when I turn to the video, I'm really just explaining this for the test itself, but I'm not turning away from the patient. So I'm going to do a neurological check first. Do you have any dizziness or if any reports of dizziness?
Sometimes if I stand up too much.
Okay, stand up. Any headaches or anything else?
No
any
headaches.
Numbness or tingling in
No.
your hands or fingers or any other extremities or feet?
No.
Okay. I'm going to do another check. I'm just going to check your perla. I'm going to do your pupil. I'm going to come from the side and just keep your eyes straight as I do this and as I go through. Tell me when you see this. I'm going to look for the reaction in your pupils. Okay, I'm going to come from this side. Okay, thank you. Okay, thanks. Next thing is, can you just get up and just do a general walk? And just walk, show me, just want to observe how you walk. Okay, thanks. Okay, next I'm going to actually now do cardio. I'm going to check some of your cardio. Do you have any issues, any history of heart problems or chest tightness?
Pericarditis, but that was like 25 years ago.
Okay, any current recent chest pains?
No.
Any swelling in your extremities or legs or arms?
No, or feet, no, nothing, no.
Okay. Can you move over to the center of the couch? I'm gonna just listen to your heart sounds now. So right now I'm gonna oscillate her heart sounds and go through the checks that we learned in class and lab. I'm gonna listen in a manner that goes in a Z from A to aortic to pulmonic, listening for the S2 sound. I'm also going to be going down, listening to the tricuspid to the mitral, where the S2 sound is located. And so I'm going to be listening for any abnormalities, looking for a steady beat. I'm going to be listening for the constant lub-dub sound that I would normally expect to hear. Okay. So first I'm working from aortic. Pulmonic, tricuspid, and then the mitral. Okay, and I'm listening with the diaphragm. Normally I wouldn't be doing this not on direct clothing, but we'd be doing this on the skin, so you'd obviously have direct contact and the diaphragm would be able to hear properly and you'll get the sounds of what I'm listening for. But what I was listening for, it sounded normal, or normal pulse, normal rate of the lub-dub sound that I was looking for S1 and S2. Next thing I'm going to do is I'm going to check a couple of the pulse rates and do a couple of other checks while I'm doing this.
I do have a hip block.
Okay, we'll check the hip block after, but normally this would be in the hospital, not in the hospital, but this is the office visit. So I'm going to check, first I'm going to check the radial pulse. I'm going to do this for 30 seconds and I'll double it. Okay, thanks. I'm going to also check your capillary refill. Normally I could do this in two places, the skin check. I'm going to do this now as part of the cardio check to see capillary refill, and I'm looking for this to be under 3 seconds as the blood moves back into her fingertip. Okay. On here, can I also check your skin turgor? I'm going to also do this. You could do this for a couple of reasons, but I'm doing this to check your elasticity and then see the skin turgor for dehydration. Okay, thanks. I'm also now going to listen to the apical pulse, which is important also as part of the check, because apical pulse is at the base, at the bottom of the heart, at the apex. I'm going to listen for a full minute. Gotta do this for a minute. Thank you. Okay, I'm also now going to check for edema. Can I just see your arms? I'm just going to look for pitting. Signs of pitting. And you got put your ankles up. You put your ankles up on the table here. And while I'm there, I'm also going to check for the pedal pulse and post-tibial pulse. So looking for signs of pitting for edema. While I'm here, I'll check your pedal pulse
And pitting.
and pitting.
And you can do capillary.
I could do capillary refill, but I can check quick if you want to take your. I'll do that. 30 seconds. What's that? Okay. Doing great. Okay. Great. So I'm also listening for I would describe that as a 2+, and also the radial pulse was a 2+, so that indicates normal pulse levels or normal pulse force that we would expect to hear. And then I did check for the edema. I didn't see a sort of normal pitting. I didn't see any signs of extra pitting or anything else that you would see as part of edema or anything during the check. Okay, so you're fine. You have any other questions as far as cardio? I know you mentioned.
No.
Okay, thanks. You can move over to this side. Okay, now we're going to do respiratory check on you. So do you have any shortness of breath? Any other?
No, just feeling faint sometimes if I
Faint
get up too
sometimes?
fast, or maybe the heat in the shower.
Okay, does it hurt when you, does it any pain when you breathe?
No.
Okay. Great. So one thing I'm going to do is now I'm going to listen to your chest sounds. I'm going to
Okay.
go from this side.
Back.
I'm going to do the front first. I'm going to
Okay.
do anterior then posterior. Get this on. Right. Again, I'm using the diaphragm, but I'm going to go side to side in a Z fashion. And I'm listening for any adventitious lung sounds when I do this. Just breathe in and also breathe in with your mouth and expire. Okay. Breathe in. Okay. Okay. I could also do this side here. Breathe in. Okay. Take a big exhale and inhale. Okay. Okay, now I'm going to go to the back of the posterior. I'm going to also listen. Maybe you could just want to sit in the chair at this point or sit here.
Oh, sure. Yeah.
Sit here so I can do this. So I could face
Yeah.
the camera
Mm-hmm.
or do it this way. So same thing. I'm listening top to bottom, across and down. Listening for any adventitious sounds for for wheezing or rails or
Okay.
crackles, rhonchi, anything that has high pitched sounds, anything with that's fits those categories, high pitched, different frequency, anything that indicates consolidation. Okay, so same thing, just breathe in and exhale. Breathe in, exhale. One more time. Okay. One more, inhale. Okay. Okay. One more. Okay, one more. Okay, thanks. Also, note in my general inspection, you can take a seat back on the couch. In the general inspection, we'll also be looking for the shape of the chest. If there's barrel chested or any abnormalities in the chest, the contour, the shape of the chest. I wouldn't be verbalizing that to the patient, but just for the test itself, I'm just mentally doing that as part of my inspection process when I go through this. So the respiratory checked out fine. I didn't hear anything adventitious or anything that's indicated any sounds like that. Okay, so now we're going to move on to the GI check.
Can we leave it?
Yeah, first I'll ask you a couple questions about your GI. And also one more note before not that I didn't put in there, but part of when I document at the end, normally I wouldn't be probably document or have a computer to document some things as I'm going along. But I was doing, as part of my pulse check, a respiratory rate check also for the last minute, listening for just observing the breathing pattern and respiratory rate of the patient coming in. So I heard it was a normal respiratory rate. I got 16, which is normal. Between 10 to 20 is normal. But I did note that just for the test purposes. I did that as part of my pulse rate check when I did that before I combined it when I did the radial check. Okay, so now we're going to go into the gastrointestinal check. So I'm going to ask you a couple questions about your gastrointestinal. Any problems, any loss of appetite?
No.
Any recent cramps, nausea?
I'll feel lightheaded sometimes if I get up or in the shower, but I think it's still low iron.
Okay, so you have been checked prior for low iron
Yeah,
deficiency.
I've had that.
Okay.
A few.
So we'll make a note of that in the record. No, we don't note that in the record, but so it could be part of your fatigue.
Yep.
The low iron.
Yep.
So we'll do that as part of it. I'm sure when we get a complete metabolic panel, we'll get
Yep.
results that will indicate something similar if that's part of your past history and part of what we were here to check today. So for gastrointestinal, so you're not. Can you just lay down this way? Put your head up there, and you could just put your rest your head on the couch. So I'm also looking for the shape and contour of the abdomen, looking for a normal shape, I'm not looking for any distension or anything concave. I'm looking for a normal roundness in the abdominal area. I'm also going to check for, I'll go this way, I'm going to turn around, but now I'm going to oscillate or listen for bowel sounds. Yep, you can just lift it up slightly. No, that's fine. Using the diaphragm, right? I'm just going to go around the different quadrants, the 4 quadrants, and listen intermittently for. Here's a gurgle.
Yep.
There's a gurgle, which is normal. Okay, so I was listening for anything that was hypoactive or abnormal, but those are all normal, periodic. You can put your thing down. Okay. Well, you can sit back up. Okay. Fine. All right.
Yep.
Okay. Now I think we're going to move on to the GU, general total urine. So there's no real check. I'm just asking some questions. Do you have any problems? Frequency of urination?
No.
Any pain with urination?
No.
Any notice in the color when you urinate or anything else like that? No blood in your urine?
No.
Okay. So normally that would be like a normal, check or question. Oh, one thing, I'm going to go back because I did miss this as part of the abdominal as I'm thinking through it. Can you just lay back down? I'm sorry. So after I oscillated, I should palpate afterwards. So I know that the the steps go through, and the last thing we do is palpate lightly with our fingers for any distension or any pain or discomfort. I'm observing if the Yep, noticing. I'm also checking to see if there's any pain when I do this, or what's that? If it's firm. Yep. Okay, thanks. Sorry, I should have. That's the last one step. Thanks. Now we're back to genital irritable. I asked you some questions about genital irritable. So the only thing now I would deviate a little bit because we're not in a hospital setting, but if we were in a hospital setting and then the patient had an indwelling catheter, some things I would be looking for at this point would be the color, the amount of the urine. So I'd be looking for any, strong color discolorations, any blood in the urine, any dark yellows or anything that might indicate a number of things, dehydration, blood in the urine. So I'm just looking at the general color to make sure that as an indicator of health or maybe an indicator of infection, you don't want it to be cloudy. Be making sure it's clear. Also be looking at the output into the indwelling catheter to see if the right output we're getting the right output for the patient, measuring it against the other historical baselines and everything else we're doing for input-output checks. That would also be part of genital irritable if I was in the hospital, but as a general inspection. It wouldn't be, but it would probably be as part of a general physical checkup. It would be part of a urine sample or something that might be part of the check at the end when we conclude the exam and you ask the patient to go provide a sample. Also, probably complete blood work or complete metabolic panel would be part of that too. If we get into like the iron deficiency and other things. Okay. Last thing we're going to do is a skin and an integument system. I'm going to ask you a couple questions. Do you have any problems with your skin as far as rashes or?
No, but I do have psoriasis since like 79. I have it here and then on the scalp, but it's controlled. I just put cream on it.
Okay. Any other problems with your skin, clamminess or
No.
or dryness or anything, irritation or anything?
Well, normal dry, but just nothing that's not controlled by,
Okay. And right now, I'll just be doing a general check. Can you hold your hands out? I'm just going to check your hands. Can you turn your arms over this way? Okay. And then can you stick your legs up? Okay. And now I'm just doing a general check on the skin. I'm looking for any abnormalities in the skin. Part of my inspection process when I'm going through this too, when I did the general orientation, was also not really specifically asking questions, but through my own observations when I was doing my inspection in my head as part of the documentation. I'm looking for symmetry. I'm looking for any patterns in the facial droop, anything else. So that's just part of the general checks I'm doing mentally in my head, not verbalizing to the patient, but making it as part of my observations when I do this, right? Okay. So no problems with their skin. We would have, at this point, we could have also did the tentin part of it, or the Turgor test, but we did the Turgor check as part of the cardiovascular, so we already did that check. We did capillary refill. All right, I think that is it. No other issues with your skin. Now we're just going to go through your results and go through final checks and questions you may have as part of the process.
Okay.
Okay. I didn't find anything abnormal. I know you mentioned your fatigue as part of your iron. That's something we'll check, and the doctor will check.
That's why they put the Heplock.
The doctor will check. One thing I did check, thanks for the Heplock reminder. So it's part of the side question, but it wasn't part of the general check. If the patient was in for an IV and we're in the hospital, similar to the indwelling catheter, and they had an IV or a Heplock or anything on their arm, I would be checking for. Yeah, we could have it different places, but I would be looking at the general area itself, looking for any signs of infection, redness, swelling, if any hurts or anything else, but anything that looks abnormal, erythema, which would be indication of blood poisoning or blood infection in the area itself. So we didn't include that as part of the skin check because it was in the office setting. But if it was in a hospital and the patient had that, that's obviously something I would observe for. Okay. So now the final check. Thanks for coming in. I didn't find anything abnormal as far as heart sounds or lung sounds. I know you reported dizziness. We'll definitely do follow up with that. The doctor comes in and does a check, and mention that to him as he comes in. could be a number of things for the dizziness. I know you mentioned your low iron as part of your historical, but there could be some other things that they will probably look at or want to see and make sure that there's, you know, no other reasons for your dizziness other than fatigue, other than what you think is your iron. Well, thanks for coming in today. Do you have any other questions or concerns?
What's my pulse?
Oh, your pulse was fine. Your pulse, as I doubled it and I did the count, the radial pulse was 76.
Right.
Yeah, and it was a 2+.
Okay.
When we say 2+, it was a normal pulse.
Okay, nice and strong.
Nice and strong.
Okay.
Okay. Any other questions today?
No.
Okay. Well, thanks. They're
Okay.
great. All right. Thank you.
Yep.
Thanks. Now I hope this taped.